go. Buttons.
I'll just let everyone in then, Matt.
Yeah, please, Mike. That'd be brilliant. Brilliant. Good afternoon, everyone. My name is Matt Cornish. I'm Programme Director for Digital Services for Patients and the Public Programme. I'd like to welcome you to our first e-update on a Tuesday. Normally we have our e-updates on a Friday, but we're breaking new ground today and having an update slightly later, give other people an opportunity to be able to join us. I hope this timing works for you. The e-update, we've scheduled an hour. And we want to be able to use all of that time, or as long as you've got questions. And we really wanted to be able to provide this e-update today because it's the end of the calendar year. And so we wanted to look back to where we were at the start of the year, what's been achieved as we've been able to move past over the last 12 months, an outlook for the year ahead, which I think is really, really important for us. And very important as well to be able to take feedback, take questions from you, see what we're able to do. So we'll answer them in person, but we'll also make sure that we send a record of our answers out to colleagues who aren't able to join for the whole session. I'm joined today by two important members of the DSPP team, by Joe Dundon, our engagement lead, and by Mike Smith, who's our lead for communications. So they'll be playing an active part, as will I, in trying to orchestrate this. There will be lots of time for questions, I say, so we should be talking for about 30 minutes. So Joe, if you don't mind putting the slideshow up, I think Mike's going to press record, or will have pressed record already, so that there'll be a record, and we'll go from there. So hopefully this should just appearing on your screens, this e-update on the 5th. Next slide, please, Joe. Okay, so a brief review of what we've done over the last year. So next slide. Thank you. I think it's important because we're all about patients and the public in Wales, and so far 82,000 people, just over that, have either downloaded the NHS Wales app or have logged into it via our website version. In numbers, we know that about 50,000 people have downloaded the NHS Wales app via the App Store or by the Google Play Store. So a significant number of people already. So it's important to recognise that. So next slide, please, Joe.
Just going to get it wrong. I got the wrong slide set up. Apologies, Matt. I don't know what's happened there. It's quirks of Teams, I'm afraid. So I shall get the.
Okay, if you don't mind, show me the right one. But we've got, just while Joe puts that up, our approach across this year has been very deliberate, a managed adoption of the NHS Wales app. We've been working to ensure that patients and the public have access to it via their GP practice in the main, and then building successfully across the year. So that number and that particular slide which Joe illustrated was where we've got to, our latest position, if you like. And I'll provide a bit more in terms of some of the other metrics and key achievements in terms of how the app is being used. So Joe, if you don't mind to move to slide 4 for me, that would be amazing.
Sorry, just 2 seconds. I'm doing a different version, different way of getting in. For some reason, it's picking up a wrong version. Right, there we go. Okay.
There we go. So we've done, as I mentioned, 50,000 patients who have downloaded the NHS Wales app. We look regularly at the functionality and what they're using, and we've got just over 3,000 or so appointments which have been booked or rebooked from those practices which have adopted the app so far. Next slide, please. A lot of prescriptions. That's the key area activity. I know that our practice colleagues, those who are providing this service, that's one of the key areas of benefit which the app is providing in succession to My Health Online. And we'll continue to monitor that. Clearly, time saving for patients and time saving for practices. So really, really valuable. Carry on, Joe.
Sorry, I got on there.
And lots of interest in that other core area in the GP health record. what's in it, what it represents about our own health, what's been in the past, an area which we would like to be able to enhance in the future, but it's something which we'll be working with practices in terms of how we go about doing that. So next slide, please. Now, this is, it really represents the expanding reach of the NHS Wales app. And so if you focus first off on what you'll see is the kind of blue markers on that map of Wales, those are the CEGIDIM supported practices. Those are the practices which we worked in the early part of the calendar year. They were part of our private beta. Those are the practices we worked first with into the first steps of our public beta in April. And we got to 26 or so of those practices which were adopted before we then changed tack and moved to all of the EMIS supported practices, which are represented by all of the other markers on that particular map of Wales. And particularly in September, October and November, we adopted all of the EMIS supported practices. Important because we needed to make way to be able to retire EMIS support to My Health Online before the end of this calendar year, and to be able to adopt all existing My Health Online users across to the NHS Wales app or EMIS users. The map represents 202 onboarded practices, so 52% of all practices in Wales. And we'll talk a little bit later on about our plans to really adopt the remaining 170 odd practices in Wales to ensure that we can adopt every practice. Next slide, please. So this is a sort of timeline view of where we've been. As I mentioned, the start of the year, we were in the soft launch of the NHS Wales app. It was closed, it was contained. We were working with 10 GP practices with 706 users. We gathered their feedback. We'd drawn on that feedback and we were focused on improving the NHS Wales app and improving actually the way that we deployed it. Instead of pushing it all out to everybody at once and seeing what came, what we chose to do is to be able to work with practices iteratively to make improvements as we go, to iron out any issues where they occurred. And a big part of that was developing a GP search function, which informed us all as patients as to whether our practice was adopted or not, and allowed us to be able to register our interest for when our practice was adopted so that we as the DSPP team could then let patients know. And we continued that work right the way up until the start of April, where we satisfied the criteria to move into our public beta, which took place on the 17th of April. Importantly, and a very exciting day for us because the app was then available for anybody to download in Wales. And the Minister, I think, made a statement in the Cynnydd to that effect. So next slide, please, Joe. So between May and August, as I mentioned, a lot of our focus was about working with those CEGIDIM practices, those practices we'd worked with in our initial private beta, and then additional practices which we continue to work with to adopt the app. We ran an accelerator event with a whole host of partners from health and care in Wales to be able to look at what future functionality people would want and services could commit to. The rest of the slide talks about other features which we made available within the app to be able to signpost what other means there were of addressing our health and care needs, and the Discover Other Services was our first foray into that area, fielding a number of Public Health Wales resources. We then moved on to canvass public opinion through a digital inclusion survey to help us inform what is needed by all members of the public in Wales in the future. And that's a really important strand for us about user research and how we're able to draw on information to help our future design as well as our feedback. Next slide, Joe. And this slide takes us up to the here and now. In the slide before, we were doing a lot of work with a particular system supplier, supports GP practices. That supplier was ready to start work with us at the beginning of September. And so in a compressed period, we worked with 3 practices to understand that everything was working with that supplier, which then enabled us to really get going with the accelerated adoption of EMIS supported practices, those 174, which took place between October and November. Our efforts have been recognised. We were, singled out as a finalist for the UK IT Industry Award. And for the immediate future, our last planned release this year is due to take place next week, So we're looking to deploy the health timeline and health journal to be worked out and tested in a number of practices just to prove it's working as we intend. And also the first step of integrating with the Swansea Bay patient portal, due to take place just ahead of Christmas and be working into the new year. So really exciting for us and exciting as a pathfinder for others to follow. Next slide, please, Joe.
Okay, so this is for me to take over, I think, Matt, now. So just to give you a flavour of the phases that we went through in a visual format, this is just to show where we are at the moment. So we're at, as far as evaluation and planning now for phase 5. So all the EMIS practices Matt has just said have been onboarded, and now we're looking at the phase 5 to make sure that the other 178 Sedgden practices are also available as well. We've also been using a feedback mechanism within the app to capture feedback from patients, and it's really useful as well to capture the sentiment with the Qualtrics surveys. And that's remained consistent over month on month, even with the increasing amount of incoming feedback. So over this period, the cumulative feedback, positive feedback, has shown that it's been at 60% or over, or averaging 62%. Negative for sentiment is averaged about 22%, and neutral is about 16%. So we're also trying to look at the practices and how we make sure that they are ready for going forward for Sedgden as well. So there's a few things that we need to sort out with practices for going forward. I'll go on to the next slide. Sorry, I have two screens, apologies. So the work that we've been doing on the evaluation of Sedgden practices has been really useful for us. So again, we can get feedback from practices as well as patients, and this really informs us going forward to make sure that we're doing this gradually and making sure that things are in place ready for the big bang, I suppose, more practices coming on board. We've also done a lot of evaluation through this phase, and again, it has really been really useful. We've also picked up that some things are the same for both practices, for both systems, but there are differences as well. And again, is incorporating that into our help pages and support pages as well, and the toolkit. On to the next slide, just to show that again, the EMIS practice evaluation was done in a much shorter timescale than we'd done with Sedgden. So instead of having 6 weeks and over 700 patients, we actually managed to do this within 3 weeks with over 100 patients. Again, getting the right results as well, which is really useful. I'll go on to the next slide. So as you can see, I think Matty, were you going to do the next slide?
I can do that. So we'll talk about our adoption plan for the remaining Sedgden supported practices. We've been working really collaboratively with our primary care colleagues within Digital Health and Care Wales, and we recognise that there's going to be a need to provide the NHS Wales app at the same time as running on some support to My Health Online using the Sedgden system. And the reason for that, main reason for that, is that currently there is no proxy access feature in the NHS Wales app. We want to develop that proxy access feature, and we don't want to disadvantage anybody. So our intention is to run on and work together for that period. And then once we've closed that particular gap, our intention then is to work with primary care to effectively call an end to support to My Health Online, retire the system, and to have moved everybody across to the NHS Wales app. But a point I'd stress is that the majority of users would want to be using the NHS Wales app, because our functionality will soon far exceed that of My Health Online, and it's the future resource which everybody in Wales will have access to. And so what our plans are to be able to work with our primary care colleagues to be able to talk about the next phase of that plan. We learned a lot from the adoption with the EMIS supported practices. If you just go back one, Joe, we want to be able to take that learning and apply it to the Sedgden supported practices. I think that's important, and I think that it provides the right resources and time for practices to be able to move across to the NHS Wales app and to be able to see the benefits which you can bestow. So go on to the next slide, please. I mentioned a little bit, in one of the earlier slides, we were recognised in terms of finalist on the UK IT Awards. That was very pleasing, so to speak. But it's also important to recognise that our sponsors have also recognised not just what we've achieved this year, but also the potential which far outstrips that. So we go to the next slide, Joe, which sets out what Minister for Health and Social Services said recently in a Senedd debate. And I'd highlight, the NHS Wales App and electronic prescribing are clearly essential in the modernisation of our health service, giving citizens easier and more convenient access to their health information. So that's important. We recognise that's important. Next slide, please. We also recognise that the debate was a really rich debate, and members of the Senedd provided valuable views. So from Darren Miller, functionality of the app is excellent, huge potential to make a lot of difference. Next slide, please. And from Sarah Murphy, and I know firsthand that Sarah had spoken to a number of DHW colleagues who'd provided valuable answers to her questions, which then allowed her to be able to make the statements below, which you can see, and her intention of planning to download it so she can get the benefits from the app, particularly in regard to repeat prescriptions, what we offer already. And then to the last slide, this section, and from Russell George to be able to talk about what the NHS app will be able to enable people to do, and the benefits, some of the clear benefits about reducing paperwork and people waiting in phone queues and being able to do what we want them to do, to be able to be empowered in how they manage their health and care. So it's important that our sponsors and kind of political figures are recognising the future for the NHS Wales app. So next slide, please.
Okay, and so over now to back to me. So with, again, just giving you a breakdown of the top 10 sentiment topics that we've had, and prescriptions have been very positively taken on in the user interface. But we have noticed that recent issues with EMIS Web had impacts on our statistics, with prescriptions being the area patients have most noticed the fault. For the first time, a topic other than the app's user interface has been the most frequent discussion point within feedback. And negative feedback's mainly about concerning the lack of appointments available, or modules not available or enabled at a practice because the practice hasn't been onboarded yet. We have also picked up that comments relate to lack of non-repeats, technical issues from EMIS, and a request for a nominated pharmacy option, which is in the pipeline. And again, I think this will be really valuable for patients being able to nominate their pharmacy in future as well. So all in all, I think we've been very, very pleased with the feedback that we're getting, and the sentiment level that we get as well. The support that we're providing to practices, so working very closely with our DHCW primary care colleagues as well, is the fact that GP practices have had demonstration sessions as well as direct engagement sessions, and they have a follow-up interviews after onboarding. We've provided a GP practice toolkit and quick reference guide for patient conversations, as well as incorporating feedback surveys to identify improvements in our onboarding process. They're also part of our events and get the DSPP updates and newsletters, but also we want to make sure that they have a GP practice communications guide as well, so they can download some of the materials locally to support them promoting the app to their patients. For patient side, we've been very lucky having the access to a bilingual app help and support web pages and videos, which our business change facilitator has been creating. And also working very closely with Digital Communities Wales to train their digital champions, so they have a community hub leads across Wales to help us set up and use the NHS Wales app, which is again going to be very important for us. And we're developing a map to support GP practices so they can point their patients to where they can get some extra support. We also want to make sure we're getting all the feedback that we can and polling within the NHS Wales app, and also by notifying the patients when their practice is onboarded. And we've also now just set up user research panels, which is our way of capturing people who really want to be part of any work that we're doing on prioritising new features, to testing and giving us feedback throughout the work that we're doing, but also using that for the other sister programs within DHCW, such as the Digital Medicines Transformation Portfolio and Digital Maternity Cymru as well. So again, that's really, really encouraging. So about 1,700 people have already registered, and we hope that will increase over the next year. So
Thank you, Jo. So looking to the future, what's next in 2024? Now, I describe this. We've got a really busy work package which we're developing with our partners. And I'll highlight some of the most important things within that work package. Arguably the most important for us is the development of a Welsh identity verification service. If I describe what that is, that's a means of being able to provide access through NHS login, which we use to authenticate to the NHS Wales app for those people that can't currently prove their identity online with NHS login. It's a gap which exists. So there are people, quite a number of people in Wales, who can't currently get through NHS login, a service delivered to us by NHS England. We've been working really collaboratively with partners in NHS England and NHS login and our delivery partner to put together the design of a solution. We're meeting every other week in terms of putting together that plan, and we're intending to kick that off in the early part of next year, so that, you know, in the period February to March, we'd like to have our solution in to ensure that everybody in Wales can use NHS login and be able to access the NHS Wales app. Other than that, there are other important things which I would want to talk about. We certainly need to do important work in respect of adopting the Cynnydd supported GP practices. And so we're developing a plan with our primary care colleagues in DHCW, and we'll be communicating to practices what that plan is, so that they can make preparations, recognising that I know that January is always a really, really busy time. There's a question in the chat, but this is an important one. Third-party integrations. We're planning to move further with our colleagues in the Swansea Bay area with their patient portal, the first real integration with the NHS Wales app. And it is a seamless experience from going straight through NHS login through to the NHS Wales app, and then accessing services in Swansea Bay for patients in that area into their patient portal. So, you know, that's going to be a real test case for us and exciting for us to then explain benefits to other health boards across Wales, so that they can adopt similar and make full use of that capability. I also mentioned that proxy access is going to be important to us, and we want to continue the discovery activity we've undertaken on various proxy use cases for parents or carers with young children, perhaps linked to the same practice, but also with adults with caring responsibilities, perhaps across different practices. So we want to put in a solution there, or solutions there, which really matter to people and allow them to be able to support those that they need to. There is wider work taking place as well with medicines, with the acclaimed Digital Medicines Transformation Portfolio and the EPS service. So we want to work on prescription ready functionality, which will save time for people, save time for practices, and is high time for it to be unveiled. And then lastly, that public communications campaign, so we can drive up interest in the NHS Wales app so that more people can benefit from what's on offer. But we are minded not to recommend and not to push towards that until we've made significant progress in adopting all GP practices in Wales and being able to ensure that people have got access to the services which we're making available. And so we've done the planning for that, but it won't happen until we've made significant further progress. Next slide, please, Jo. We've put a slide here which kind of, really encapsulates that national campaign around the strapline: your health and well-being, anytime, anywhere. That's what we feel that the NHS Wales app provides. And as you can see from the illustrative pictures, people in different circumstances, looking to manage their health and care in a way which matters to them. So that's what we're about. That's going to be the campaign. It will be carried out by a whole range of different digital and non-digital kind of routes at the right time. But our approach in the immediate term is working with practices and the communications which they can send to their patient base to encourage them to use the app and use the features which we have available. Next slide, please, Joe.
Okay, so just to give you a flavour of the health timeline and health journal, we thought we'd just put a little bit of a description up to show what the timeline will look like. But it has been developed as a navigational tool in chronological order to display summary details of date-stamped health and care events where personal health related data exists and other independent source or feeder systems. So we're starting off with the date and of the event, as well as the type of event displayed. And we're hoping this will be the primary means of navigation within the NHS Wales app for patients to find and access a growing range of information about their health and care. The plan is to test this with two practices, one a Cynnydd practice and one an EMIS practice, which will be Glanreed and Amlwch in the next couple of weeks. So if you already have filled out the user research panel or haven't, please do, and we'd be really delighted to get you as part of the testing process as well. We will be looking only at the moment at the My Health Journal, which I'll talk about in a second, and your appointments, just to see how those work from the GP system as well. So, but again, a really exciting piece of work happening. And the other exciting development is My Health Journal. So this is a really allowing you to write little reminders and for journal entries, so that you'll be able to store free text in here. We're using it as a memory jogger, really. So if there was something that you want to remind yourself about, or that you wanted to make sure that you've got an appointment in 6 months, just to keep a reminder, or you've got a flare-up of a particular condition like asthma or diabetes that you want to remind yourself, so that when you go to your appointment, your consultation, there's something that you've got in place as well. You'll be able to add, edit and delete these journal entries, but they won't be shared with anyone. So it's only for your benefit at the moment, but we're really excited that it also will link into the timeline, so you'll be able to search, browse, filter and jump to journal entries using the health timeline feature. And finally, really download the NHS Wales app today. Thank you.
Thank you, Joe. I think that's the last slide. So we'll take that presentation off. Which normally our joining the dot slide is the last slide that you'll see. Oh, we've got a loose mic. It's a bit tinny. I can see Mike had a hand up. Look, I said we finish in just about 30 minutes, and we've finished in 30 minutes, which gives lots of time for questions. I can see a few questions in there about WIVS, so I'll pick up on WIVS, the Welsh Identity Verification Service. Now, we'd have liked to have had that service fully live, operational earlier. We've had to work with partners, and we have to work with partners who have different timescales to ours in terms of competing priorities at their end, which is a challenge for us, but we've been working as collaboratively as we can to be able to develop a solution which is appropriate for Wales and works in Wales. We think we've got that, and we've got the commitment which we need to be able to put it in. It has been disappointing, but there have been, people in Wales who've not been able to access the NHS Wales app yet through NHS login. We've been providing as clear a guidance as we can on that, and we will provide clear guidance in terms of when the solution will be in, so that people have a really good understanding of when it will be available to them. What we would say is that where that solution isn't in place, there are always alternative routes for which people can achieve what they need, whether it's prescriptions or whether it's help and advice. We want to give people the choice of being able to engage in digital, and we want to make it as easy as we possibly can. But I want to be upfront and really, really candid about what we're doing with WIVS. We want to be able to move on with it. It's the highest priority thing for us to be able to develop into this next work package, so that we can genuinely give access to all. There we go. Any other questions? Any kind of hands up before I kind of go around and we can start picking up questions from the chat? Go on, Alan, I think you're first.
Thank you. So I'm Alwyn. I'm from the Royal Pharmaceutical Society. Thank you for the presentation. Fantastic. Obviously, great amount of work this year. So I'm noting the continuous support available for GP practices and patients, which is great. Obviously, just coming from pharmacy angle, sort of not really seeing what's happening with the pharmacy side from that presentation. Obviously, community pharmacy in particular will play a huge part, very much involved in, we've got the first electronic prescriptions now live in North Wales. So talked about newsletters, events, DSPP updates. So are community pharmacy engaged in all this work stream? Are they having all the same support in that arena as well?
I'll start, and I'll probably ask Joe to come in.
Yeah.
So it's a really valuable question, and we are closely engaged with our colleagues from Digital Meds, and we were delighted to see the kind of the start of kind of EPS in real a couple of weeks back. And so that's fantastic news and a great development in Wales. There are partners who are closest, but it's not to say that we haven't been engaging with others. And I know that Joe's engaged with a number of pharmacy stakeholders in the past. And what I would also say is that just because of our journey so far with the NHS Wales app and really kind of closing important gaps with My Health Online, actually the future roadmap is open in so many different ways. And so, that can change and we can respond to other needs. Is there anything you want to say specifically, Joe?
Yes,
about
absolutely. Yes, just to say we're in close contact with Judy Misra, from Community Pharmacy Wales, and have met up with her and decided that in the new year it would be really beneficial to come in and attend some of the sessions that CPW hold, just to promote the app, just to make sure that people are aware of what's going on. So and yeah, we do a lot of our work via DMTP as well.
That's great. No, that's fab. It's just keen to see that sort of line, because
absolutely.
I think from a CPW perspective, obviously I don't work for them, but they are a great vehicle for getting that information out to community pharmacies, and they have their own newsletters. So I'm sure but if you're linking in with Judy, that's a great sort of starting point. But I'm keen that obviously pharmacy is very much linked in, embraced, because patient queries will come to pharmacies as well, because it's sort of accessible port to call. That's great.
Absolutely.
Thank you.
Thank you, really valuable. Any other questions, any hands up before we go to other kind of questions in the margins? Come on, Tom, I think you're next.
Oh, thank you. I represent Llais in North Wales, and we're very concerned about the termination of My Health Online for prescriptions at the end of December. My own practice, for example, has nearly 500 users who are using that particular service. And so far, very, very few people are actually aware of the NHS app, let alone have the opportunity to do anything sort of with it. So what you suggest, what we certainly don't want all those My Health Online people in early January, ringing up their GPs because they can no longer order repeat prescriptions. So what do you actually suggest since you are closing it down so early?
No, it's a very good question, and I would probably start by saying we're not closing it down early. The NHS Wales app and Digital Services Patients and Public Programme don't run My Health Online. It's a legacy platform, but it is a platform which we know is unsupportable. EMIS cannot continue to support My Health Online, and they've been running it on deliberately with just enough time to allow us to be able to deploy it to all of those EMIS supported practices which I described in kind of the update. I know that our colleagues in primary care within DHEW have reached out to practices in the last week with kind of, I suppose, clear instructions to those practices in terms of how to reach out to those active My Health Online users with suggested text and suggested means to be able to bring people across. And I know that a particular practice up at Amlwch was quite successful in terms of the number of existing My Health Online users, which it was able to bring across really quickly towards the NHS Wales app. Although the primary care team aren't here today because they're engaged in other work, it is something which they're very alive to, and so they are on a week-by-week basis maintaining a close track on the number of people who have been brought across from My Health Online to the NHS Wales app, because they, like you, like us, don't want the beginning of January for people to suddenly realise that they haven't got the same level of service provision which they've had hitherto, and that they've got what we want is a managed and effective move across to the NHS Wales app. is there anything more that I can add, Tom? Is that helpful as an answer?
I think probably let me explore a bit further. We're very proud of Amlwch, and we're very proud of the work that Deborah's done there. But they retained a third sector organisation to promote the app and to help particularly older people to learn how to use it, etc. And that's been fundamental in the fact that they're getting up to about 25% of their users doing it. That's not happening anywhere else. The rest of the area feels that it's being sort of abandoned with this. And, I don't think you can put this under the carpet. There will be a number of complaints from various sort of people over the fact that instead of being a helpful situation come the 31st of December, you're doing something which is very negative for many of the users in Wales.
No, you make valid points, Tom. Look, and there's the part for us to be able to relay those and that feeling to the primary care team and to work collaboratively with them on the response to provided to practices, because I know, it's not far away, he says, until the time when that service needs to be taken down. And that's because it's unsupportable, because it can't be continued. But at the same time, we need to link with primary care to work out what we can provide as support to practices, because I recognise, there is no standard practice. Different practices have different abilities to be able to support, and this is a very busy time. So, your strength of feeling, we've captured that, and we'll link in with the primary care team when they're back in work tomorrow.
Can I also suggest that you link in with Llais? And I've been in contact with Joanna. We've been getting on very well. But Llais is the voice of the public. And I'm afraid that the primary care teams are very, very busy on all sorts of important things at this point in time. So you need extra advocates there. So I strongly suggest you contact Llais and try to help that way.
No, thanks, Tom. We will do that because we recognise that it's important, and we want to be able to get this right with our partners. I'll go to one of the other questions. Sorry.
Just to add in, Matt, that we do work very closely with Llais through Linda Joseph is a member of our Patients and Public Assurance group as well. So she does feedback into the organisation as well. But definitely the support from Llais is great. So thank you, Tom. Thanks,
Joe. There's a really strong network. What I would add, there's another kind of point in the chat I saw about a decision which was made to remove the support proxy access to care homes. Again, another action which was taken, not a requirement for digital services, patients and the public, not something which has been given to us to include within the app. And I think the reasons for that were conveyed to practices, again via primary care team, but were centred around that the app, I say, couldn't do or provide that proxy access in the same way, not just because the app is something which is individual to all of us. Effectively that sign in and the information governance by which we operate the app is pertinent to us individuals, and so we couldn't just take on what had been introduced for the right reasons, I think, during the pandemic, and then roll it through to the NHS Wales app, because that wouldn't work. Now, it's not to say that that change hasn't caused negative impact. I think it has, and I think practices have had to think about different ways of which they can support patients and support care homes. I know that the primary care team would be listening and that they would value feedback, but I wanted to kind of set that out. It was never kind of set as a requirement for the NHS Wales app. We will focus on other proxy requirements, and that's going to be a priority for us. But that particular care home one by carers is something which we haven't quite got on our roadmap at the moment. It hasn't been set for us, but if we did and we had to look at it, then we absolutely would. So I just wanted to kind of set that on in a public forum. Right, any other questions from anybody else which you want to pick up, that kind of hand variety? I can see there we go, Hayley's coming. Hayley, do you want to come in?
Hi, so I've got policy responsibility in Welsh Government for 111 and out of hours. So I was just going to ask, and apologies if I've missed it, but where the integration to NHS 111 Wales feeds into this in terms of the timescales?
I'll start there. So we've got 111 as a core feature within our app, or certainly as a link to the website. which people, it's really helpfully placed. And we've got valuable feedback right from our private beta through to public beta about actually people didn't even know it kind of existed in that particular way, and it's drawn to far more people. Now, we can always go steps further. And so part of our ongoing work is working with partners across health and care in support of policy objectives, of course. But, there's a lot of potential. We've got a wider roadmap, which we've talked about previously, but a lot of it is drawing that roadmap into the delivery space with a clear requirement, sponsor, and then we can get on to the doing. So there's a lot more that we could do, but we're working very closely with partners across Wales in terms of what we do and when. Is that all right? And I don't know if Joe wants to add anything more to that.
No, that's sufficient, Matt.
Can I,
Brilliant.
Matt, I'll just come back on that. Sorry. So
Yep.
when you say working with partners, in what forum would we want to take that forward then, in terms of understanding some of those timescales and things? Because if the conversation's already happening, it's just to be aware of it, I guess, and to be part of that.
Yeah, so I suppose our closest contact, from Welsh Government side of things, is Ryan Perry, who's our sponsor, DPIF sponsor. But we're also working with, the meeting before this, I addressed the digital directors. So the digital directors of every health board and trust in Wales. So I spoke to them about what we've achieved this year, but also the future. But we're also engaged with the strategic transformation programs. And so we're shortly to start a bit of work with the planned care program, which looks at benefits and what benefits could be achieved from displaying waiting list information in the NHS Wales app and more, hopefully. So it's trying to get that up front so that those particular programs, parts of the NHS, can work out what we might want to do and what the NHS Wales app could be a great vehicle to do. So that just provides an illustration of what we're doing. Is that helpful? Thank you. I can see we've got a hand up from David. I see David's also put something in the chat as well. Do you want to come in now, David, with your question?
Hello there. Yeah, it was just to say the question, if that's okay, because it was at the top. I didn't want to get it missed. So obviously, I've been a big fan from both perspectives of the app, and I'm looking forward to it. My practice came online to it, a technicality, but there's no actual features switched on. So I know that's dependent on the practice to be set up, but is there any kind of timeline to encourage and support the practices to kind of take up features across Wales, so there's a more even service across Wales, kind of like a timeline and a process in place for all that?
What I'd say is that, as I described in my presentation, I suppose our main effort, I suppose, is making sure that we provide all practices with access in the first instance. There's a part which we're working at in terms of what we're finding, and we've done deeper dives in previous year updates about what people have found to be useful within the NHS Wales app, and also, what they found to be less useful. And particularly in the useful space, particularly where it links to the service offering provided by practices, that's the stuff which we're taking to those practices and want to be promoting to them, as an example, to illustrate the types of appointments which they might want to choose to make available to patients. Because not everything is about a appointment with a GP, is it? But also about the appointments which, at the very base level, without providing any, they could also provide the ability for appointments to be returned to them, so that they don't have the DNAs and the wastage which they could have. So it's going to be encouragement. It's going to be working with sponsors as well, because we recognise that all GP practices in Wales, there's a GP contract. In the future, there might be a requirement for practices to do more, but that's not for us to determine. That's for practices and GPC Wales and Welsh Government sponsors and others to be able to think about how we can best use the NHS Wales app and to be able to try to bridge actually what's offered, because we don't want to be a source of disunity or a source of a kind of patchwork of services. We want to encourage practices to be able to use the app and the services which we provide in a way which is effective to them, but also is effective to patients. Is that helpful as a kind of illustration of the sort of path which we're on, David?
I think it explains your position on the matter, so thank you. Yes.
Yeah. Okay, thank you. I've got another question there. Who's next? Is that, I can see one from Adrian and then Bernie afterwards. Adrian, do you want to come in?
Yeah, thanks very much. I think those issues about sort of interoperability with things like 111 as well raise some important questions about the overall strategy for the web and digital estate. Because at the moment, particularly for a small nation, I guess the web and app architecture for Wales is quite fragmented. The interface so far between the app and 111 clearly is clunky because it's kind of linking through to a web presence. And NHS 111 itself, as far as I understand it, the website is a program that isn't currently getting any funding for sort of maintenance and development, and is on a completely different web architecture than the rest of the NHS web estate as well. So those opportunities to try and think, we've got an app here, we've got health board websites here, we've got 111 websites here. How do we truly turn that into a seamless experience for the patients and communities that we're here to serve? I acknowledge we're never going to get it quite right for my residents in Powys, because a whole chunk of their experience is across the border in England. But we've even got messages from Welsh Government about this aspiration to develop in our single waiting well website. It's like, why aren't we in a place where we can try and bring this all together into a single digital architecture that works seamlessly for us as residents and us as organisations?
Right, so firstly, I suppose I hear your comments, but I suppose, you know, the NHS Wales app is the first, you know, central single gateway, you know, that's existed in Wales. And so the things which are hanging off it in an effective way are going to add advantage. So people know what's in a particular space. Now, there will be a continued development and improvement of some of the resources which we have. So we have 12 or so resources provided by Public Health Wales. Things like Healthy Weight and the like, which clearly also exist on as other websites. And that's our first foray into this discover other services. We're shortly to commence a procurement for an accreditation partner, and the first requirement for that accreditation partner is to help us with actually curating a list of resources which we want to be to maintain in the app over and above the 12 that we've currently got. And that could be in every aspect of health, well-being, lifestyle, the things which matter to all of us, and the things which we're, you know, really, really keen to be able to provide, you know, so that people have some assurance that it's not just what's top of your Google search engine. It's actually gone through a process of assurance before it. And the NHS, you know, a trusted body representing all of Wales, is saying, you know, we think this could be useful to you. So that's the first step for us. But there's also, you know, deeper levels of integration which we have, and that partner will help us. You know, we've got some learning in that space already, you know, with the Swansea Bay Patient Portal and some of our other pathfinders in Cardiff and Vale. And so we want to be able to build that. It's not something which, I think your kind of question alludes to the point, it's not something which is going to happen instantly, but it's something, if we've got the right framework to start with, then we can build upon it. And actually having the NHS Wales app as the core platform is that foundation, I think.
Yeah, and 111 feels like a great opportunity, but linking back to Hayley's point about really trying to build that connection so that all of that information is in one place. It might feel a bit intractable at the moment, but if we can get there, that would be a joy.
I think also making sure with it links in very closely with the national data resource as well, Matt, so not just the apps and connections, but it's also the data that's held within our systems as well. But actually also recognizing that there are other products that people want, which are websites, podcast, videos, e-learning materials, which aren't really what the NDR probably is functioning and looking at. So it's, again, it's, if there are suggestions that you have, then please do feed them into our to what we're developing as well. I can add to our alignment catalogue.
Thanks, Adrian. I do like the Powys backgrounds, by the way, because they are very Christmassy. Let's go to Bernie next.
Hiya there, thank you. I'm a service designer for Centre for Digital Public Services. We're partnering with DMC. The current project obviously is the digitisation of maternity records, and obviously part of that is procurement of, or potential procurement of an app that will be, you know, kind of records, you know, the gamut, right, of end-to-end maternity journey, and obviously that's massively kind of connected to this. And I guess one, just hello, we're here. You know, I'm working very closely with user research researchers, you guys also have them on your side. So, you know, wasted or very valuable opportunity to join up and see how we can do this. And the intention is to prototype and you know, kind of understand how pregnant women and people, you know, will be onboarding and doing this journey. So I guess, how do we work together? What kind of opportunities can we do? I know you've mentioned DMC already on the call. You've talked about interoperability and integration, and you know, I think earlier you mentioned the 12 key areas that are being services that people want to use, and obviously, you know, half the population are female. So yeah, where are we on that list? And yeah, how can we be here to work better together, basically?
Thanks, Bernie. No, you're definitely on the list, and you were had a conversation with John Pinkney and others earlier on this year, actually. And we understood your timescales and the work that you were doing, and trying to get a procurement ready, and the intention for that to go out in the early part of next year. And we offered, you know, some of our feedback, just to make sure that the requirement to integrate with the NHS Wales app was included within that procurement document. And so it's kind of evident of the work which we're doing with a number of different partners across Wales. So what we're trying to do is we kind of think of the DSPP and the NHS Wales app as a kind of planet. And so we're trying to work out where the other planets are in their respective orbit. And so who we need to get engaged with at what particular time to understand their readiness to come into a work package, and then to be able to be either integrated with the NHS Wales app or a connection of sorts. So that's what we're on. You're on our kind of extended sites, and I suppose it's when you think there's an opportunity to be able to share learning or to say, hey, this is where we are, then do connect with Joe or myself, and then we can work out how best to orientate our next contact. Because I think what we said in the meeting earlier on was that as opposed to putting an arbitrary date, we thought we'd agreed we'd let you carry on with your work and then come back together when you thought was the most appropriate time.
Fab.
Is that
Okay.
right, Bernie?
Yeah, we're doing prototyping and what's not kind of starting in the next few weeks and months. So I'll get myself and the interactive designer to reach out, and we'll see what we can do. Thank you very much.
Yeah.
Thank you. Should we go back to the questions? Because I realised that we've taken a few from on the chat. Let's have a look. Is there anything which you want to pick out, Joe, or to?
I think there's just a lot about the linkage codes, which is an issue we do recognise, but this has been set up through NHS logins screens. So that's the discussions, as you said earlier about WIVs, that we're having discussions with NHS login, and I think they do recognise that there is a discrepancy and an issue there. So we are aware of it, but in the meantime, I think because of the timescales, it could be quite short, rather than changing out all the processes to put something back again that we might have. Then I think we're just going to be ensuring we've got the right materials available for you to know what to do when patients come in asking about linkage keys.
Okay, I can see a couple of questions. I can see one from Andrew Langley about again to do with My Health Online, again SMS credits. We'll take that to our primary care colleagues to understand the status of that, Andrew, and we'll ask them to get back to you and to other practices as well. So yeah, we'll pick that particular one up. Let's have a look. Anything else which you want to flag, Mike, or any questions you've seen we've not adequately answered yet?
No, there's nothing that I've seen which we haven't already covered. Yeah.
Okay. Any other questions? Anyone want to raise a hand or the like? There we go. Andrew.
Hi. I was just going to ask about record access. We haven't allowed our patients to actually look at their full records online. I'm not sure whether or not that's a direction that we'll be forced to go down in future. The problem we have is we can't have a sort of dummy patient to just check to see how it would work from a patient's perspective. You know, we don't know how, for instance, test results. If we allowed patients to see test results, would they actually see the test results before the doctor have actually acted on them? You know, we're a bit cautious about allowing patients this sort of access. It would be good for practices to be able to have a dummy patient or some sort of access to the back end so we could see what it'd be like from a patient's perspective.
No, go on, Joe. You come in there, and I'll add a bit afterwards.
Yeah.
Go on after you.
So Andrew, we have There is a mechanism of setting up test patients, but you need an NHS login account in order to set up the test patients. So that could be done if you would like one. We can sort that out. The records. We've got the digital detailed coded record is available. I think has been available through My Health Online as well, and it's up to the practices to decide what to do there. But I think also with test results, there's a 72-hour block before they're released. So I think that was already built into the system as part of My Health Online. So again, I think it's probably worth having the discussions with the primary care team to understand how things work. But we have got a couple of case studies from practices which have already switched on DCR, and I think it might, if that would be useful, just to have conversations with other practices who have allowed this, then it might be some way of allaying fears on how it works and how many patients do get in touch as well. But I think that might be useful doing that.
I think it's fine to have some sort of mechanism where patients can be told if the result is normal or if they need to book a GP. But it may be a sort of dangerous territory if we start giving them the actual figures and things, because they'll start asking more questions and it might increase demand, if anything. And of course, if we're going to share records, we've got to be able to redact information. I know you can do that on an individual basis, but if everybody, if we're deciding to sort of give access to patients, we can't sort of decide on an individual basis. It just becomes a sort of huge admin burden, really.
Your valid points, and so we are, giving an illustration of one of our current strands of work with primary care colleagues about understanding how we would reduce that admin burden for practices, because as I understand it at the moment, to provide access to detailed coded records almost done on an individual by individual patient basis, which probably takes up a huge amount of your time, or would take up a amount of your time. And so I know that one of the system suppliers that works in Wales has adopted something similar in England, whereby they're able to provide less admin heavy ability for practices to be able to enable, i.e. to bulk enable. And so but we want to look at it in the whole, so there is no kind of imposing, certainly not from our perspective. And so we want to be able to present what the opportunity is and what this can provide to patients, because we've had some valuable feedback from patients through the app about what they can see and what that's enabling them to do, but recognizing the kind of safeguards which you've kind of you've set out.
Okay, thank you.
Okay, I can see is there one more question? Go on, Valerie.
Thanks, Matt, and hi, Joe. My practice has recently gone onto the app, and I've been able to order a repeat prescription, and the ordering of the prescription is very simple and easy. But what it doesn't tell me as a patient is when my prescription's ready for me to collect from the practice, or when it's gone across the road to the pharmacy, because the pharmacy collects them as well. So I don't know whether eventually the vision is that there will be an end-to-end process and I'll be able to see at every stage where my prescription is. At the moment, it would be really useful to know when it's ready for me to collect.
Joe, do you want to answer that one?
Yes, I'll do as best as I can. I know, Val, it is in the pipeline and is part of the electronic prescribing service. That function is available and it links in with the nominated pharmacy function as well. So I'm not sure if it was available in My Health Online, but there are things that have been created there, I think, which I think does show you when you're due to collect your prescriptions. But I think it's one to go back to Dave, Matt, and just find out a bit more on that, if that's right, Val.
Right.
We'll do that, Val.
Great, that's great. I mean, my app isn't showing me that it's ready to collect, so I don't know whether that's an individual problem for me or a problem for a lot of other people. It tells me when it's been approved, but approved doesn't mean collectible.
No,
I think those are the features which we're building into the current work package, or the next work package. So we're expecting that to take place between the 1st of January and the 8th of April. We haven't signed it yet, but that's what we're going to be doing. and we're expecting to bring that functionality to you and to everybody else in Wales. So yeah, we're not that far away, I don't think. It will be built in that period, and then will be deployed slightly afterwards. So I'm, that's why I kind of relayed to Joe, because I think that's a bit of positive news in terms of completing that journey.
Great, thank you very much.
Thank you for raising.
Thank you. I think we're up at time. Thank you for everybody who's joined us today. Thank you for everybody who's joined us on all of the updates which we've had across the year. We want to be very transparently explain what we're doing, what we've done, and why, but also take feedback in terms of other areas where we need to keep working. And so we've picked that up loud and clear today. Mike, do you want to talk about next steps and actually what we've got for the new year when we'll be planning the next update, and then we'll wish everybody well for Christmas.
Yeah, absolutely. So the next update we've got currently penciled in for the last week of January. The link will be provided, same as this one, via email, and you'll get an access to this recording of this event and follow up with a Q&A of everything that we've discussed and written answers to all the questions posted in the chat and during this session. So keep your eyes peeled for the email and the link to sign up for the next e-update session.
Fantastic. Diolch yn fawr. Have a lovely Christmas. I'm wishing you well for the new year, and we'll catch up then and give you another update on progress. So thank you all.
Thanks. Thank you very much.
Thank you.
Thank you.